The Physio Control LIFEPAK 15 is a versatile defibrillator monitor used in emergency medical situations. It offers several modes and functions for providing advanced cardiac life support in critical care. However, the specific steps for using the device in all modes might vary depending on your training, region, and version of the device. Always refer to the manufacturer's instructions and follow your local protocols. Next is a general overview of using the LIFEPAK 15 in various modes. Using the pulse oximetry. Ensure the LIFEPAK 15 is turned on and functioning properly. Check the pulse oximetry sensor for any damage or malfunctions. Make sure the patient's hand or finger, usually the index finger, is clean and free from any obstructions. Avoid placing the pulse oximetry sensor on a finger that has nail polish or artificial nails, as they can interfere with accurate readings. Attach the pulse oximetry sensor to the patient's finger. Some sensors are designed to fit snugly and provide a stable reading. The LIFEPAK 15 should have a display where you can monitor the patient's vital signs. Look for the SpO2 reading, which represents the oxygen saturation level in the patient's blood as a percentage. Interpretation. A normal oxygen saturation level is typically around 95 to 100%. However, acceptable levels can vary based on the patient's condition and medical history. Lower levels might indicate the need for supplemental oxygen or other interventions. Keep an eye on the SpO2 reading as well as any trends over time. Sudden drops in SpO2 could indicate a change in the patient's condition. Troubleshooting. If the pulse oximetry reading seems inaccurate or unstable, ensure that the sensor is properly attached and the patient's finger is positioned correctly. Also, check for any issues with the sensor itself. Taking a blood pressure. Ensure the person is seated in a position of comfort with their arm resting on a table at heart level. Remove any clothing that might interfere with the placement of the cuff. Place the cuff on the upper arm about an inch above the bend of the elbow. Make sure the arrow on the cuff is aligned with the brachial artery, which runs along the inner side of the arm. Let the patient know to minimize movement as you will be taking a blood pressure. Initiate the blood pressure by pressing the NIBP non-invasive blood pressure button on the LIFEPAK. Once the blood pressure has been acquired, it will read on the bottom left corner. The end-tidal carbon dioxide. Preparation. Ensure the LIFEPAK 15 is powered on and functioning properly. Make sure the end-tidal CO2 module is properly connected to the device and the appropriate sensor is attached to the patient. Place the patient in a position of comfort for monitoring. They may be intubated or using a face mask for ventilation. Attach the EtCO2 sensor to the patient. The sensor typically includes both a sampling line and a cannula or adapter that is placed in the patient's airway via ET tube, supraglottic airway, etc. to measure the exhaled carbon dioxide levels. On the LIFEPAK 15, navigate to the EtCO2 monitoring screen or module. This display should show you the waveform and the numerical value of the EtCO2. Interpretation. The EtCO2 waveform and numerical value provide information about the patient's ventilation and perfusion. Normal EtCO2 levels are typically around 35 to 45, although acceptable levels can vary based on the patient's condition and ventilation settings. Keep a close watch on the EtCO2 waveform and value. Sudden changes or deviations from the expected range could indicate problems with ventilation, circulation, or other physiological issues. If the EtCO2 waveform is not displaying or the values seem abnormal, check the sensor's placement and ensure it's properly connected to the patient and the device. Also, you can use the DOPE acronym. D. Displacement. O. Obstruction. P. Pneumothorax. E. Equipment. Document the EtCO2 readings along with other vital signs and patient information. This information is important for tracking the patient's progress and response to treatment. Remember to transmit your readings to ImageTrend. Manual defibrillation mode. Turn on the device using the power button. Attach the electrode pads to the patient's chest. Select the appropriate energy level for defibrillation. Charge the defibrillator by pressing the charge button. After the device is charged, ensure everyone is cleared and deliver the shock by pressing the shock button. Pacing mode. Assessment. Before initiating cardiac pacing, a thorough assessment of the patient's condition should be conducted. This includes evaluating the patient's heart rate, rhythm, blood pressure, level of consciousness, and overall clinical status. Ensure that the LIFEPAK 15 is properly powered on and functioning. Make sure the device is in pacing mode and that the appropriate pacing electrodes or pads are attached to the patient's chest and back, or chest and anterior posterior locations. Depending on the patient's condition, you may need to choose the appropriate pacing mode and set the parameters, including the pacing rate, pulses per minute, and energy output. These settings are often determined based on the patient's heart rate and the type of arrhythmia. While increasing the amperage, ensure that you get manual and mechanical capture by feeling for a pulse and ensuring that the line is in the appropriate spot over the rhythm. Once the settings are configured, the device can be activated to deliver electrical impulses to the heart. The electrodes or pads transmit these impulses, helping to stimulate the heart muscle and establish a more regular rhythm. While pacing, closely monitor the patient's response to the treatment. Observe the patient's heart rate, rhythm, and overall clinical status. Adjust the pacing settings as needed to achieve the desired therapeutic effect. Continuously reassess the patient's condition while pacing. If the patient's condition improves and their heart rhythm stabilizes, you may consider discontinuing pacing. However, if the underlying cause of the arrhythmia is not resolved, further treatment options such as medications or additional interventions may be necessary. Synchronize cardioversion. Used to treat certain types of abnormal heart rhythms, particularly tachyarrhythmias like ventricular tachycardia. It involves delivering a controlled electrical shock to the heart at a specific point in the cardiac cycle, typically during the R wave of the QRX complex, in order to restore a normal rhythm. The LIFEPAK 15 is an advanced defibrillator and monitor used by medical professionals to provide emergency care, including synchronized cardioversion. Here's a general overview of the steps involved in performing synchronized cardioversion using the LIFEPAK 15. Assessment. Assess the patient's condition and determine if synchronized cardioversion is appropriate. This decision is based on the factors such as the patient's symptoms, the type of arrhythmia, and the overall clinical picture. The LIFEPAK 15 is prepared for use. Electrode pads or paddles with conductive gel are placed on the patient's chest. These pads or paddles are connected to the defibrillator unit. The appropriate settings are selected on the LIFEPAK 15. This includes pressing the sync button and setting the energy level for the synchronized cardioversion shock. The energy level is typically lower than that used for as unsynchronized defibrillation, as the goal is to convert the arrhythmia without causing harm to the patient. The defibrillator monitors the patient's heart rhythm. The device identifies the R wave of the QRX complex of the electrocardiogram and uses this as a reference point for delivering the shock. Synchronization ensures that the shock is delivered during a specific phase of the cardiac cycle to increase the likelihood of a successful conversion. Shock delivery. Once the device is synchronized with the cardiac cycle, a controlled electrical shock is delivered through the electrode pads or paddles on the patient's chest. The goal is to interrupt the abnormal rhythm and allow the heart's natural pacemaker to re-establish a normal rhythm. After the shock is delivered, assess the patient's heart rhythm to ensure that it has converted to a normal rhythm. If necessary, additional synchronized cardioversions may be performed with higher energy levels if the initial shock does not successfully restore a normal rhythm. Thank you for watching. This concludes our review of the Physio Control LIFEPAK 15.